If you need dental implants, the same questions are likely to be raised. How much does it cost? What do all these numbers mean? Temporaries, finals, healing. Today, I'm going to answer the questions that patients ask us first. So the first question I have here is, how much do full mouth dental implants cost? Man, if I had a nickel for every time I got asked this question, I get asked this all the time. And the truth is, it's really hard to answer. If I could give you a direct answer, I absolutely would. Let me tell you why it's so hard to answer. Every single human being is unique. Everybody is different. Not only genetically, but also through your life experience. How many teeth have you lost? Do you need bone grafting? Do you have a lot of bone loss? How many implants do you need? 4, 5, 6? Do you have health-related concerns that we need to be aware of and address? There are so many nuances to giving a fee for full mouth dental implants that it's just impossible to do it as a blanket statement. And I would caution you, if you're seeing some advertisement that says some fee, how could it possibly be right when those things are definitely true? The fact that everyone is different means nobody can give you a direct price. And in all likelihood, if they're giving you a price over the internet, it's a bit of a bait and switch, would be my guess. Who's to say that you are the same as your neighbor or somebody, down the street with what you need in your mouth? The next question is, what actually happens on surgery day? So in our practice, we call this transformation day. It's so important to me, it's so important to us that we highlight the fact that this is a transformation. To be honest, not only just for you and the transformation you're gonna encounter, but for us. It's truly transformative for us to be able to see so many people's lives change. It's pretty incredible. That said, what actually happens on surgery day? So on surgery day, you're gonna come in fasting because you're gonna go to sleep for the procedure. It's the easiest dental visit you've ever had. It's just so simple. You come in, you get an IV, you go to sleep, and all the heavy lifting is done while you're asleep. Because of that, it's a very, very easy dental visit. After you're asleep, that's when, what I said, the heavy lifting happens. So we remove teeth if that's needed for you. We take out infections if that's needed. We place implants. It could be, again, 4, 5, or 6, or 10. Just depends on the individual situation. We're really well aware that most of the patients that come to see us really are not huge fans of the dentist. I myself am not a huge fan of going to the dentist. And so we've tried to create an experience that's very different. One that, kind of meets you where you are and makes it a really comfortable experience for you. So once the procedure is done, we wake you up and we'll put your teeth in. At that point, you're numb, so nothing in your mouth hurts. We get all the numbing done while you're asleep, so you don't feel any of the shots, the dental shots. Those teeth are fixed, so it's not a denture. It just goes right onto your implants. All of the data, all the information that we needed to be able to do that, we got while you're asleep. And that's it. You're done for the day. And then we send you home. So the next question is, do I come in with teeth and leave with teeth? Not everyone comes in with teeth. We have a lot of patients that come in with no teeth at all. But if you have teeth, you'll certainly come in with your own teeth, and you will absolutely leave with teeth. Doing this many, many thousands of times, we have had 0 patients leave without teeth that day. Not to say that it can't happen, it could. You could have some scenario where you don't leave with a fixed bridge. It just hasn't happened yet. So my next question here is, how many dental implants do I actually need, 4 or 6? Well, it might not even be 4 or 6. It could be 7 or 8 or 10. And I'm talking about per arch. It could be 10 implants just on the top. It really depends on the person. The question is, does it matter over the long run? And the answer really is no. In fact, it only matters in the short term how many implants you have. We've placed thousands and thousands of implants every single year, and we track exactly what happens with every patient and every implant. And so we get to see exactly what makes a case successful and what makes it unsuccessful. And it turns out the number of implants is not correlated at all with the long-term success of your case. So my next question is, what determines whether someone needs 4 implants versus 6 implants? So in the last question, I said it doesn't really matter if it's 4, 5, or 6 over the long run. That said, it matters a lot in the short term. And what determines that? Really, it's the bone quality. So there's three things that make a dental implant successful. The amount of bone, that's the bone quantity. And when you hear about bone grafting and things like that, that's really what we're talking about. The quantity, how much bone is there. The second thing is the bone quality. Well, how dense is that bone that you have? If I compared it to wood, you have balsa wood on one end and you have walnut on the other end. Well, they're both classified as wood, but they're extremely different from one another. So what if you had just a mile wide of balsa wood and compared that to a thin piece of walnut? What is stronger? Well, actually the thin piece of walnut is still stronger than the balsa wood. And then the last thing is the gum tissue. So the gum tissue is very often forgotten and many people don't talk about it, but it is equally as important as the amount of bone and the bone quality. Another thing to consider is that more implants may actually be worse for you. So certainly you could have the foundation fail, which that's the number of implants, or you could have a mechanical failure. A mechanical failure is just all the parts and pieces that go with this. So number one, you have a dental implant. Number two, you have an abutment. The abutment is what connects the implant to the teeth. And number three, you have the teeth. Connecting the teeth to the abutment is a little tiny screw. And it turns out that the failures that happen within full mouth implants are actually mostly mechanical failures. They're not biological failures. They're not foundation failures. They're actually failures of the mechanism. So the little screws, the little parts and pieces can fail. As we add complexity, as we add implants and we add these little tiny screws, we add opportunities for failure. Is 6 implants always better than 4? Absolutely not. There are many cases where it's worse. So my next question is, if I get teeth right away, why aren't they the final teeth? So this is a great question. This is a question I don't often get actually, but I think is in the mind of a lot of my patients. So we initially give teeth with a temporary set of teeth. That temporary set of teeth is 3D printed, but essentially 3D printing is very fast. And so while a patient is in the office, we can 3D print a new set of teeth that's based on a digital design. It looks beautiful that we've already mocked up kind of on a three-dimensional photograph, and we can create it very quickly, like in an hour. However, when we can make something very quick, it usually means it's not that strong. And so when we give you something permanent, we want it to be really strong. And that just takes longer. There's the science of what we do, which is making this thing and designing it, but then there's the artistry. And as we all know, you cannot rush an artist. If you want the most exquisite, the most pristine looking teeth, it takes a master ceramist. A master ceramist is this technician who truly is an artist. And this artist is adding character and design to your teeth to make them look like you. They're literally sitting there with a photo of you and characterizing your teeth to make it look right for you. So my next question is, how long does it take to get my final teeth? Again, it depends. And that's because you're a unique person. I'll tell you that on average, our patients get their final teeth somewhere between 2 weeks and 4 weeks after their procedure. So pretty quickly. Industry standard is probably more like 7 to 10 months after their procedure. So we are really conscientious about you and your experience and maybe how much you don't love going to the dentist. And we try to really abbreviate this and make it as quick as possible without ever compromising on quality. So my next question is, what does recovery actually look like? So we surveyed a few hundred patients a couple of years ago to see how bad was their discomfort after surgery for that week after surgery. And the average score came back as a 4 or a 5 out of 10 on the pain scale. And that came down to a 1 or a 2 when they took their prescribed medications. To me, that was just honestly a shocking result. It was really kind of amazing that all this work that we did and lots of things, grafting and removing infections and placing implants and removing teeth. And in the end, patients' comfort was pretty darn good. So my next question is, do full mouth implants feel and function like real teeth? Well, they feel and function the most like real teeth of all the possible solutions that are out there. They are certainly different than real teeth because they're not real teeth, right? They are made out of implants and a bridge of teeth. Again, this is where being minimally invasive really matters. The thinner the bridge of teeth, the more gum tissue you have. The more gum tissue you have, the more you feel like natural teeth. So the last question that I have is, am I a candidate for dental implants? So I get this question all the time. In fact, basically every single patient I ever see asks me this: am I a candidate? The truth is, in today's day and age, with surgeons that are oral maxillofacial surgeons, with designers, and with prosthodontists, virtually everyone is a candidate, even with severe infections, even with medical problems. When you choose a provider that is a physician, a dentist that has partners who are prosthodontists, the level of complexity just makes us excited. It doesn't intimidate us. This is something we do on a daily basis. And so we tend to be able to take on cases that others may have said, you're not a candidate. And I would encourage you, if you've been told that, to seek a second opinion. We'd certainly be willing to see you for that second opinion. If you still have questions about dental implants, we put together a checklist that you can find down below that will give you the questions that you should be asking to your provider and give you some answers.